what is our problem with religion. By the way, I'm a Christian. I have a lot of issues with religion because they have projected illness to be demon-based, to be something is causing it, aside the fact that it is sickness, and something that is most likely curable. So our people are not seeking solution in the right direction, and they are dying every day. And guess what? In churches, people die, they don't talk about it. They make it quiet, and that is over. Church goes on. Mosque, whatever religious, traditional people, they go on, they as if nothing happened. So when we believe that, the cause of this problem is demonic, the solution we are seeking will be where we will not get solution. And like I tell everybody, if somebody dies, you fall into the census. 20 people died yesterday. They don't have name. They are faceless. They are nameless. Nobody cares. 50 people died yesterday. 75 people died. Who are the people? The people who are alive, what are they doing? So that's the problem we have. So when a pastor or an imam or a traditionalist goes on to tell you, do this, break this, do that, that makes also thing, they worry you. And our people tend to believe them more. Why?
Yeah.
Why? I'll tell you why. The fundamental issue is in poverty. If you know you can access health care without having money in your pocket, I think a wise person will go to the hospital first. But when they check the cost, they rather believe that it's not medical. So they can get a cheaper, more supernatural solution.
I mean, if all I have to do is read like 7 chapters of Psalm and fast for like 7 days.
That one is good though. Some people break cola, no? Some you wash sand. Some bath river. Some go to a crossroad and drop a white bead and white this and white that.
Yeah, just get a bird.
Just get a bird, break
2 eggs.
Turn the thing on your head 7 times and then drop it in that place. Why bother with going to queue up in UPTH when you're already seeing the solution and they tell you that the enemy will be destroyed totally? Something that drug will not even pay up to 1,000 to cure. Until when it's bad, when it's totally bad, when the case is almost irredeemable, they will then say, rush and go teach your hospital.
How about the government? If it's poverty that is at the center, shouldn't the government be helping to uproot poverty? Because that means if poverty is taken out, then every other thing would dissolve. So what then is the role of government in actually trying to, we hear stuff like alleviating poverty. Yeah, so many programs to alleviate poverty.
But we never get to see anyone. But the role of government, first of all, are the upstream, up there, policy making, the rules, the laws around healthcare. How do you make policy? How are they implemented? How are they brought down to the grassroots to help the people? How much money is being allocated to health? How much money is allocated to healthcare workers? How many healthcare workers do we have? You see, now there is a lot of jabai
in the health sector.
In the health sector. So somebody was saying that very soon, when doctors don't leave finish, everybody will start treating themselves. How much is being given to the health sector? How many nurses, doctors, how is the employment in the health sector done? The ones who are employed, how are they properly taken care of? How are the teaching hospitals equipped? How just be equipped? If you bring an emergency, do you have what it takes to take care? Is there NEPA light? So when the government impoverish the people, their health will naturally dwindle because health is about money, outside lifestyle. Even we talk about living healthy. Can you afford a decent meal? Can you will be able to rest? Do you work yourself to death because you are looking for money to pay your children's school fees? So everything centers around government. Assuming a fundamental basic education which have been given free, even the government have tried in primary section and some secondary schools to make it free. Assuming education is accessible for free, assuming there is food and there is shelter, what will an average man hustle for? The small money you have, will you be able to use to take care of yourself? What are the insurance policies? How are they being implemented? How are the people being helped? The health insurance policies. So even when we have donors, international donors, people come in to donate towards a cause, does the money get to the grassroots? or is it truncated somewhere and somebody uses it to enrich him or herself? So government is to be blamed. I don't want to totally blame. We all will be accountable for our health, but if the government makes the environment easy, makes money available, makes policies, build hospitals, equip them properly, we have gone a way high, into achieving health for everybody. But then when we come to the people, you are responsible for your health, especially if you're in Nigeria. If you're in Nigeria or in Africa, you should be responsible for your health, because you don't want to be seen in an emergency. You won't like the result. You should try as much as possible make you not get emergency. As simple as I'm saying it, is funny, but that's the truth. Because I was telling you off camera that if somebody falls on the road now, there's no 911 to call. There's no ambulance to carry it to hospital. If we go to UPTH or teacher hospitals, they may not, because the place is congested. Everybody's sick. So nobody can even carry it there. The only thing you can get from that place is, I saw this small boy die. The person may even be alive. Some people even bring out their phone and record and post on social media and not give the person the immediate help. Does even an average Nigerian know what to do in the case of an emergency? If you meet certain emergency, do you have basic knowledge what to do? You see what I'm saying?
Wow. Yeah.
So don't find yourself in emergency. It's not funny. And then if you are sick, don't wait until it progresses and is worse before you seek health care. The basic rule for recovery or healing or treatment of any illness is early presentation.